Welcome again. This is the Family Support Webinar, Cultivating Hope, Learning from the Bester Community of Hope in Maryland. All right, and we do have with us today Paul DiLorenzo, who is Chair of the Children's Trust Fund Board, and he is going to be introducing us to our presenter.
Well, good. Thank you so much. Appreciate that. It's really exciting to be here with all of you today. I am the executive director of a foundation in New Jersey, but I live in Pennsylvania and have been the chair of the trust fund board for a few years. And this is actually my second time on the trust fund board. The purpose of the Children's Trust Fund in Pennsylvania is to prevent child abuse and neglect. And the primary way we do that is through grant making. I'm sure some of you have either been grant applicants and maybe recipients, hopefully. And this year we've had an uptick in the number of applications, we think in large part because of the fact that we've spent some time doing a revision of the document itself and some of the processes for application. So we hope that those changes have made a difference for you. I noticed as people were signing on, a number of you are from family resource centers, and those are dear to my heart. I started my work in state government many years ago, and I was the person who had the lead role in helping to develop the family resource centers across 3 departments. And the good news of all of that is they have survived over a number of years, administrations and political trends and everything else, mostly because they are accessible and they make sense to families. So thank you for all the good work you continue to do there. I'm here, though, today to introduce someone who started as a kind of a colleague, became a coworker, and is now a friend. Keith Vanjoy leads work in Hagerstown, Maryland. For those of you in central Pennsylvania, Hagerstown is pretty much a stone's throw away. But Hagerstown, in many ways, resembles a number of the smaller and medium-sized cities and towns in Pennsylvania, where there are both pockets of opportunity and pockets of challenge, but mostly long traditions of how things get done. And Keith's organization, when I first met Keith, was primarily a residential program for kids. He'll talk a lot about that, but with a strong desire on his part and the part of his board and community members to try to move farther upstream in their work with families to prevent the placement of kids into foster care, to strengthen families, and to create more supportive communities. And the primary reason that I wanted Keith to come here today is in part to talk about the development of that work and how it has evolved over the last several years in particular. But this key issue of scaling the work, in other words, being able to sustain the work over time, but also to reach the number of kids and families that you have to, so that you begin to make a difference, so that you move the needle in the community. Not, a handful of people, but really reaching a larger number so that you can begin to see those reductions in child maltreatment reports, reductions in the numbers of kids entering care. And then on the flip side of that, the strengthening of families and the engagement of communities with kind of people within communities with each other. The story that Keith will tell you is in large part a reflection of his leadership and his leadership style, but I think it's fair to say that he's backed by an incredibly talented and committed team of people who have remained a part of this work over a long time. He's had an active and I would say engaged board, and also people in the community who have bought into the model and created a culture around the way they support families. So that both public agencies, the government, county-based agencies, as well as the nonprofit community, the faith community, educational community, and even small businesses have been a part of the work that Keith and his team have done. So With all of that being said, I'm going to turn it over to Keith. I know that people are going to have lots of questions. I'm not sure how, Jennifer, you want to handle those, but perhaps you could, just have them go into the chat, or if you want to stop people, however you think is best. Keith, it's all yours.
Thanks for the nice introduction, Paul. And again, Keith Fanjoy, I'm the director at SanMar Family and Community Services. And like Paul said, we're in Western Maryland, about an hour west of Baltimore. Been doing this work for a long time at SanMar, about 20 years. And I'm a clinical social worker, but started out doing case management and family service work. And then just over time, became more and more concerned with the system as it was currently designed and wanted to be more responsive to the needs of families. So, quick thing about me is that if you ever meet me in person, it's a very different experience than meeting me on this screen. I am 6'10", so I'm a giant person. So, if you ever see me at a conference or in public, you'll know who I am. Um, so what I'm going to do today is I'll spend about 15 or 20 minutes just walking through some of the development of our work and what we do today. It's kind of two big chapters of the story, but I think most of our time together, Paul and I will be just available to answer questions or talk through kind of the work that we do. So I'm going to go ahead and share some slides and walk through our programs, and then we'll go from there. All right. All right. And so, Christine and Jennifer, you guys can see that, right? Okay. So, again, Bester Community of Hope is the initiative that is under the umbrella of SanMar. I started Community of Hope, that program, almost 13 years ago now. And it started as a very humble operation. And I'm going to walk you through some of that origin story. So, like I said, I was a social worker operating inside of a treatment foster care program. I had started my career in East Baltimore and then came towards Western Maryland. And then, as a part of that journey, ended up at SanMar. And so I was doing treatment foster care work with a group of boys. And just kind of early in that career, I had an opportunity within this agency at SanMar. SanMar was known for two things. We operated treatment foster care, but we were known for providing residential services to teenage girls who had experienced abuse and neglect. And we were very well known for that. I mean, we're a 140 plus year organization with roots in the orphanage times and group care times. But from the mid 80s until the 2010s, we were really known for gender-specific care towards teenage girls in our residential capacity. This was in a community setting, and so these were youth that could be in unsecure environments, the vast majority of which were youth from the Department of Human Services, Child Welfare. So I had an opportunity where my predecessor said, Keith, we could probably use you helping out with overseeing case management services in the residential programs. And so I spent the next 7 years doing that. And in that journey, I just had countless conversations with kids, the way that I'm sure many of you on this call have had, kids and their parents, about if, there was a key resource provided at a key time, um, they probably wouldn't be in our facility. Their parent probably would be in a better circumstance if they could have just accessed a resource. But when a traumatic episode happens or a very severe incident happens, all of a sudden, a lot more resources become available. And so it just became this pattern. And it was a concern that I felt that SanMar was doing really amazing work, creating a very nice environment for kids on our campus and in our foster homes. But it wasn't better than a child being in their neighborhood or with their family. And so the system was somewhat set up in this way from a reimbursement standpoint. And I didn't know how to kind of work around it. So just like many of you, I just kept doing good work within the structure that I had available to me. But this moral dilemma persisted, right? So just like you're on a training today, I participated in an activity in 2012, 2013, and it was a 2-day training that afterwards I had heard from lots of people across the country who had told me how they worked within a rigid system and found a way to do upstream work. It was very difficult, but they found a way. And I came back to Sanmar and I told the CEO at the time, I've heard there's a way to do this. I've heard that I can actually do the upstream work that I would like to do. And I would really like to do that here, but I'm definitely going to do it somewhere. And so that led to a very deliberate process internally. And I think this is the first lesson for the group in terms of early awareness, which is, and things you might consider within your own organization. Once I made that decision, I spent a year in-house amongst our leadership team talking about this. I talked about prevention. I put it on the table and I said, this is something we need to do, even though it wasn't something we were doing at that time. I just continued to put forward the moral imperative that we know there's a better way. Why aren't we doing it? And ultimately, why is our organization even in existence? Why do we exist? And I was able to cultivate enough shared understanding and shared will towards this fairly altruistic idea, right? That the system is rigid now, but I want to create this big preventative program. And the leadership allowed me, and they said, Keith, will allow you to keep doing your job and you can do this too. So I was able to have the luxury of two jobs. And it was before I had kids, so I had a little bit more time to pursue the dream. So, but they had a strategic planning process at the conclusion of this year of what I would describe as organizational soul searching. I think that there had to be some remembering of why we entered into the field of social work, some remembering of why we pursue a job that is so difficult. It's not just to perpetuate a system that has its issues, it's to actually advance it. So once I was able to get the organization, a very old, well-established, well-regarded organization, to turn a little bit towards this belief system or this idea, there was a couple key sentences added in our next strategic plan. And the strategic plan, I mean, it's tongue in cheek, but it said something like prevention on the last page. And, Keith's going to explore what other people are doing and bring back some of those ideas and figure out how Sandmark can do that. And it was very limited in terms of the scope, but what it required is on every quarter, we were going to have to report to the board about progress on that. It was an important moment. And because we were prepared, the next key thing happened, which is that I met Paul. We were at a state association conference, and Paul got up and started talking about building communities of hope. He talked about a lot of the things that we were wrestling with internally. The problem is it was not as favorable of a concept across most providers that were doing traditional child welfare because people were focused on a couple key items: getting the rates up, getting enough kids in care, just to be able to maintain uh, the types of services they were already doing. And the idea of prevention was less proven, not funded, and a big challenge, right, to move. It required a commitment to a key belief system. So I met Paul because at the end of his talk, there was not a standing ovation for his message because a lot of people probably were struggling with this idea, and it felt somewhat offensive. It was almost feeling like at times people are attacking the existing model versus pointing towards what the model could be. So there was no line to meet with Paul. I went right up to him as this giant young guy, and his first comment to me was, I don't, he's a member of Casey Family Programs at the time. I don't know that we have a lot of money right now for this, but I said, I don't need your money. I need help figuring this out. I need help figuring out how our organization can do this. And he started interacting with me, started interacting with our board, and came and did a site visit to Hagerstown. And I think he started to recognize, like, okay, there's some momentum building here, and this group wants to do something. They just need help. So we joined a group of sites across the U.S. that became part of a demonstration project called Building Communities of Hope. Um, Once we were involved in that, a couple very key things happened. One was that um, we went through these three steps of sharing our vision with our community and hosted lots of community leaders. The next step, a couple months later, was looking at the local data and talking about where the needs were in our jurisdiction of Washington County. And we were able to start to zero in on some key zip codes. And then finally, we announced the south end of the city of Hagerstown is where we're going to go. But at this point, there's no funding. There's no funding at this time in terms of being able to implement the operation. So all it was at that time was a community initiative to do a needs assessment and to break that down and to respond to it. But once we identified the South End, there were key activities that occurred that started to bring the community together. You see some photos here of a famous event we had, which was a spaghetti dinner. And we went to the local elementary school and asked the community to come together to talk about the future of how we can work together. And we had 900 people show up. It was really crazy. We had 900 people show up to this spaghetti dinner, and we talked about working together. And a lot of community leaders were there and recognized, wow, there's a lot of adults, families that want to see progress in their community, and it shifted some of their mindset. A year later, our local county Department of Social Services provided some funding to provide some in-home wraparound services because we already had this existing community initiative and we had a local foundation that had given us some money to get started. Then the social services agency decided to come alongside that and invest in a couple staff for wraparound. And then we were on our way. So a lot happened between these two slides. So I'm actually going to come back to this slide here in one second. So um, this really talks a little bit about the journey from this wraparound family services model to deeper investment in the neighborhood safety net and the core work of the Department of Human Services. But just to go back, this journey that we were on for 8 to 9 years, from 2016 of the Department of Human Services in our community funding us, all the way up until January of last year, was really difficult, challenging day in and day out work to be able to provide wraparound with very little resources. We were navigators, we were shepherds to families in a high poverty community, but we had basically created a new division of our organization known as Bester Community of Hope that was focused on prevention. At the same time as we opened that service, we closed all of the old versions of our service. We closed all of our residential programs and began totally focusing on this moral imperative. But 8 to 9 years in, the struggle was real in terms of being able to pay for this service, being able to justify the long-term outcomes in terms of prevention. And a great thing happened along the way, which is a new leadership came into Maryland and announced the Enough Initiative in Maryland, which is a comprehensive place-based grant investment in children and families in the state. And because of that 10 plus years of work, doing day in and day out with a team of 7 or 8 people, we were positioned as one of the top 3 sites in Maryland to receive enough funding. And so there are tiers of funding, but it is a multi-million-dollar investment. And so what is the Enough Act? So the Enough Act takes this wraparound work, which is the foundational effort, family-driven work that we do in a particular zip code going to families in their home. And then it acknowledges that part of what makes that work effective is two additional needs. One is enough resources within the neighborhood safety net, and the other is the neighborhood itself. And the grant funding that we received through Enough allowed us to do both of those investments. So I'm going to touch on those things real quick. So on the left box, it talks about family services. If we had 600 or so people that were served within a year in family services, we received through Enough things like a family scholarship, which is basically another version of a cash assistance program, but it was focused on families in the benefits cliff. Prior to enough, we didn't have that. We only had access to entitlement programs. So it just strengthened the effectiveness of our wraparound model. Um, the vast majority of funds through enough are going directly to either the pockets of families, resources for families, or service providers going directly into the family home. And again, I talked a lot about not just the safety net, but the neighborhood improvement as well. So here's a few highlights of some of the new resources that we're investing in through the Enough Act. So these are safety net resources. So there's no child care providers, zero in the South End area that we served, and one family-based provider in that entire area. And so we've had this fund for a year. We've already opened one child care center and we're getting ready to open a second one. So very exciting that we were able to catalyze that. I don't have to, if you have watched the news, you know that there's a lot going on with challenges with immigration at the federal level. And so in our community, it's obviously also front page news about Hagerstown and what's going on with building a warehouse and things like that. Through the Enough Act, we are funding a couple key staff that are basically directly providing services to those diverse families that are translators, they're specialized navigators, and they work directly with the local churches, a network of churches that are there. Um, Housing and spaces. So, we have two partners that we fund staff at the local community action agency as well as the local home store. We do surviving to thriving there. So the idea is if it's an emergency, we'll help with a hotel stay, but rental assistance is available for families that are in that zip code. And also our total goal is to move folks in the longer term to credit repair, financial assistance, and then home ownership in some circumstances. We partner with two agencies that help with grief and loss, as all the trauma that's happening in our neighborhood, but also mental health and substance use. There are providers that do this with insurance. These are no insurance required, barrier-proof types of services, and these are co-located within the schools within our zip code. And finally, these are a couple other key providers that provide concrete goods. So the United Way has a very unique, like old drive-through bank window where they can distribute hygiene supplies, but they also co-locate those services at local community schools. And one really unique example is Children in Need. Children in Need is uh, it's an agency that donates and gives away clothing to kids in local schools, donated clothing. We've given them wagons to give away. This is just a unique example, wagons to give away to all the families that need them because Bester Elementary, which is the core school in our community, is a no-bus school. Everyone walks to school, but they also have some of the worst attendance rates in our county. The wagons are not the solution. The wagons are a way to provide a basic service that is going to ease some suffering, but we're using that to, by the fall, purchase multiple vehicles for the school and use this as a way to advocate for the extreme need. And we're going to purchase three vehicles, basically large vans that will assist with chronically absent students to hopefully improve those scores. So again, these are examples as I wrap up here and we move to some discussion. These are examples of the journey of an agency like ours to move from our old model started with these key beliefs and values and a desire to do something different, to do something that was less about putting a band-aid on a problem and more about stopping the problem from happening. It was built on this foundation of wraparound services. And now, because of additional funding, we can invest in the safety net and invest in the neighborhood in terms of revitalization. Very unique projects are coming out about the physical environment, the investments in those spaces to improve what that looks like. But again, a lot of this comes down to building trust, creating better access for families to have the resources they need, and then the residents themselves driving this process about about change in their own community so that they can own it for the long term. No matter what happens with funding, no matter what happens with our agency, they can own it over time. Um, so I'm going to pause there and give maybe Paul and I, we can walk through some of the priorities that you guys might have in terms of questions or comments. It's a much longer talk in terms of getting into the weeds of key aspects of how we do wraparound and key aspects of how we are organized and structured. But Paul, I'll pause there and then maybe we can hear from folks if there are
Yeah.
questions.
And I do have a question, and I think it's especially relevant for those people who are here today from community-based and neighborhood-based programs like family resource centers or something similar to that, maybe early childhood centers. And it has to do with the fact that I think what you guys have taken on in Hagerstown, Keith, is more than building a program. It's really creating a culture. Um, and maybe you could comment about that. And I'm just curious as to some of the people who are on here today, especially the family resource centers that have been up and running for years now, how that kind of mindset changed in the community, right? The belief that what you're doing is the way to approach the work. It's not an alternative. So just wondering if
Yeah,
other people have
it's,
viewpoint.
I think the reality is in some ways it's much harder to do what we're doing. But it is also tremendously more fulfilling and satisfying to know that what you're doing is a better way of doing it. I think we had some advantages going for us. So certainly the traditional child welfare model, the older way of doing it, we did that really well, and we had a reputation of kids and families first. We were known for that. So I think that's one important advantage is that maybe you have to find the thing within your organization that is a strength that you can build from. And I think that was one of our strengths was our reputation and the trust that we had. I also think that people that were attracted to our organization maybe weren't attracted because we were the highest paying organization or, you know, we were a smaller, but in some way almost like a boutique restaurant, like people knew when a kid was referred here that they were going to get a really high level of service. So from that process, I think there's room for discussions about what's the best, right? Because that's what we're all signing up for when we come and join this organization. What's the best way to do this work? And so I think that organizations on the call, I think I would imagine everybody on this call is doing really important, good work. But is there room for that kind of dialogue at the table about doing things that are not just hard, but they feel tremendously like it's not just a burden of the heavy lift, but are we courageous enough? Are we brave enough to do something that may not work? Are we brave enough to do something that we don't have all of the answers figured out? And I don't know that it's for every organization, to be honest with you. I think every organization has to wrestle with it and ask themselves, are we ready to go all in on a process like this? But you probably don't start out with that decision. You start out with trying something, trying one aspect of this kind of work. And I think it will unfold in front of you in a way that shows you like, we're doing the right things. We need to just find a way to do more of it. Um, so yeah, I would say build from your position of strength, Paul. Build from this idea of values are really the driver for us, shared values and shared commitments, and it's from families. It's we don't. So I will say we have a mental health clinic today. We have a small treatment foster care program. We do implement things like evidence-based practices, but in a lot of this work with wraparound work, um, that is just an aspect of the work. It's really what does the family want? What do they need? How do we come alongside that and let them lead the way? And as a courtesy in that journey, maybe they want to hear some of what we see, but they need to be in the driver's seat of the work. And so that's just a big philosophical shift from traditional child welfare that is heavily focused on the child versus the parents as the expert and giving them what they need so that they can see long after I'm gone. So,
Um, Keith, also questions about, um, I know you've been fortunate with this more recent infusion of dollars from the state. But prior to that, and going forward, you've managed to put together a combination of public and private money. Can you talk a little bit about that, the kind of the blending?
yeah, when I early in this journey in the 2017, 2018, we were a few years in and piecing together different funding streams. I think as somebody that was in a leadership role, that was an area of risk. We're trying to do something that at that time there really wasn't a reliable funding stream for. And so I was really hoping Paul was very generous in his day at Casey, where he allowed us to visit various sites. We went to sites all across the country and studied how they did their work. I was really hoping that there was an answer in those places that was talking about the pot of gold at the end of the rainbow that was going to fully fund all this work and do everything that I needed all the time. And I think two realities just became really clear. As of now, in society, a pot of gold at the end of the rainbow is not there. Even this tremendous opportunity that we have today, there's a clock on it. We're trying to work through a sustainability plan, try to think about over time how this goes. Now, that's probably not the best news, but here is the good news. Because we have this unshakable commitment to these values and this strategy, we'll figure it out. The organization is going to figure it out because we've decided this is important. This is how we want to do things. And we're ultimately just, we have to find a way to make it happen. And so it may mean pivoting and diversifying funding and moving things around. And I think that's the right um, message to your staff also, that, that's some of the burden in my leadership seat is there is tremendous instability, but the organization has to be the not never ending buffer, but the stabilizer for staff and say, look, I don't know 5 years from now what this looks like, but you can count on this year and next year, like we're committed to this, even if we lose money. It's okay. Like we're not here to make money. We're here to do this innovative, great thing for families. And hopefully, if we just keep doing the right things, we're going to draw and attract the right people and the right resources. That's what we really lean into is the belief system and focusing on the work. I'll tell you what we don't spend a lot of time on. We try not to get stuck in lots of meetings. Um, it was like a very early statement in this process to our community partners. We just say like, really appreciate the dialogue and the talk, and we do want to hear and listen what people feel and say. Like, but I need people at the table that are ready to get dirty. Like we're ready to get work done, and I think that there's sometimes this loop in some efforts that don't move as fast, where there is just a lot of theory talk and not enough. Here's what I'm going to go do next week. So that's just a call to action for some. That how do we put a date on the calendar and say we're gonna have very thoughtful, deliberative listening sessions, but by this date we're gonna do something. I don't know what it is, but we're gonna do something.
Keith, the other question I have is around your workforce. By the way, your comments, what you're saying is getting really good comments here. I'm just curious if you could maybe talk a little bit about the workforce issue. My impression is that you've had a core group of people with you from the beginning. They've stayed, they've hung in, even when things have gotten a little difficult and challenging. Um, and once people come to work there, they seem to stay. Just
Hmm.
curious as to if that's accurate, and if so, what are you doing what's the secret sauce? Because so many people in counties across Pennsylvania uh, feel like they're stymied because of workforce issues. Can't find people. We find people and they leave. We try to interact with the local child welfare agency at the county level, and they're having difficulty finding staff. There's all these kind of workforce issues. I'm just, like to know or hear from you
Yeah,
about.
a couple things. One is, we can't discount good luck. I mean, that's certainly part of that. But I think that I think the two big things that has been, at least in my style, is it's people that are drawn to this work and people on the call, this may resonate. It's like um, you're doing this work because you want to make a difference, right? And then so the moral injury thing is real. If you are in a circumstance where you feel that um, you're working so hard and you're just not sure if the system is using you in the best possible way. And so how does the system adapt to the staff versus the staff adapt to the system? So we've tried as an agency, I think, to do two key things. One is just really talk about what the values are. And that's not just like rhetoric. It's like when people come with a challenging situation with a family, it sounds very bland, but the answer is kind of like, what's the right thing to do? And why don't we just do that? And so again, it just sounds so simple, but sometimes systems are not always allowing that. Now, we do have some unique flexibility as a nonprofit, right? So not all government can completely do things the way we do it. But I think just values first is one. I also think as a nonprofit, we have the flexibility. That's an advantage we have generally is that flexibility conveys respect to staff. So they have additional autonomy, they have additional ability to get their work done. And I've, joked with staff before, I'm not going to be the one that's standing out your office at 9 a.m. wondering where you're at because you have a scope of work. You have things that got to get done. I mean, you're going to turn in a timesheet with X number of hours in it. But I think that generally speaking, people have a sense of agency and they are honored for their expertise. And I think that when they explore their options, because all our folks have options, right? That we're competitive enough in terms of the resources we can provide, and they have agency, flexibility, and they don't have to compromise on their values. So those are just things that staff have told me in terms of reasons they stay.
Um, Anyone else want to chime in? I don't want to take all the questions here or any questions from the group. Like, I don't know if people are able to go off mute or not to do that.
I believe they can, but if anyone is having problems, just please put a message in the chat and we can get you unmuted if you want to say your comment out loud. We do have, some lovely like affirming comments. Oh, Mike said they can unmute, so and if anybody wants to speak and ask your questions or make some comments, please feel free to unmute. But we did have some lovely affirming comments in the chat, and I've seen a lot of, hands clapping and hearts and such as you all were speaking. But I don't see a question right now.
Yeah, so maybe just one other thought, Paul, is just this
Yeah.
idea in the early journey of our development of this work. Paul had me meeting various leaders in other parts of the country that were doing this, and it wasn't just conversations about how do we pay for this, but it was also speaking to what it takes, what it takes, right? And so I talked earlier about I don't know that this work is easier. It's in some ways much harder. But I think that if there is a commitment to doing this way, it's invigorating. It's invigorating in terms of having what you need and actually seeing the results with families. It just gives you more gas in the tank. But there is that small caution of the same way I was cautioned, like, hey, Keith, like, yeah, you see, you're really energized about this, but you know how hard this is, and there's not a lot of money out there. And this is 10 years ago. I mean, there's much more money today, not endless, but there is definitely more resources today. Christine looks like has her hand up.
Yeah, I'm glad you touched on that. One of the questions I have, we see these small building blocks and they build over time. What advice would you give to those who are working and starting to build up their programs? Because sometimes we can really get burnt out on
Mhm.
sustainability plans
Yep.
and everything. So what would your advice be to keep on going kind of advice?
So this project started with me by myself in an office. No one else was in the building. So it was in a small community office in the center of this neighborhood, and then I hired one staff. And so prior to that, there was a couple years of work that was the team at Sanmar, people like Paul that were providing TA, other community partners. But when it came down to it, I was the deputy director of the agency, and I stepped down as the director of this new program, Bester Community of Hope, under our umbrella. And we had ambitious goals of things that we had to accomplish, but they were all attainable. And it was, I think, key things are going to be. I told Paul early on, like this can't be a one person job, can't be, for a variety of reasons. But it at its minimum, starting out had to be two people, for reasons like, what if I'm not around? What if I leave? What if something happens there? There needs to be this internal succession plan or sustainability plan in terms of knowledge. But I also think that this idea of how to sustain, yeah, there's no, I really wish I could say that there's this pot of gold at the end of the rainbow. The thing that sustains me is the work itself. You have to develop a passion for doing this way. And everybody comes to things like social work or human services for their own reasons. So we do talk in an agency level about each other's why. Why do I make a choice to do these really hard things with families? People may have had their own lived experience. They may have been associated with a family member that has experience. Maybe it's their faith or whatever. But that has to be part of what sustains you in those darker times, because there's plenty of them. And again, that comes back down to these broad terms like our values. The values are not just the agency's values. Do your values align with the agency values? Is it something where the things that you're passionate about you see every day at work? And if not, does your workplace allow that input so that your thinking can be included in that? So I think more than anything, that's what has sustained workforce. It's what sustained the operation. It has sustained it from a small thing to a big thing is people see what they care about at their job.
Keith, I want to ask you about the role of schools and educational
Mhm.
institutions or organizations in your work. I know early on that was an important part of the model. It's evolved since then, but you're still obviously involved with the local educational system.
Yep.
What would you say to people about the connection between what they're doing in the schools?
Well, I probably don't have to say to the folks on this call that it can be a unique relationship in terms of times where it works well and times where it doesn't. So I think that our early journey was as a neighborhood kind of organizing effort, and then quickly we partnered with the elementary school at the heart of the neighborhood, true upstream work. We had a dynamic person in the seat who was leading that school, who
Yeah.
welcomed us in and included us. Many schools have a much less welcoming tone, and that is because of deep concern about liability and protection and keeping kids safe from outside folks. You would imagine, as you know, that there is this desire to welcome in as much help as possible, but not every leader is ready to divert away from these core academic priorities. So I early on was very pleased with the partnership with the school because of the unique leaders that were there, and then very discouraged at times by what felt like just a lack of shared commitment to doing these things. And And so we had times where we had to pivot and shift our energy out of the school building into the neighborhood, and then the different leaders showed up in the school, and we kind of pivoted back. Again, it's like I said earlier, we're going to figure it out, right? So like the work continues. There's going to be changing seats, changing people. Those are just excuses to stop. We're not stopping, right? And that's the key message that I think people have become really accustomed to is like politicians now kind of want to check in with us. New people want to meet with us first because they know we're not going anywhere. We're a lasting investment in this community, and we'll probably still be there when those people move on. And so they want to collaborate with us. It just takes time to get to that. So don't lose hope when you're going through these ups and downs. It is quite difficult at times, but you just have to return to this, why I do this. It is the right thing, and have a certain kind of resilient and relentless approach that, again, okay, like we have some internal talks at times where somebody drops the ball outside of the agency and we have to pick it up. It's like, all right, I guess we're going to do it. And it doesn't, it's not always enjoyable. I'm making light of it, but there's not room for that excuse, right? Like we're not going to let others who drop the ball stop us from getting what needs to get completed. So.
Keith, I have one more question, and I don't know if anyone else in the group will have any. If not, I'll leave it to Jennifer to decide if we just, we'll end a little early. My final question really has to do with fun, which is, something that's been a kind
Yeah.
of hallmark of the work that you all have done. It's about service and support of families, and certainly the work can be difficult given the challenges that some of the families are facing. Having said that, you guys have done some really uh, enjoyable events, things where people come out in droves,
Yeah.
whether it's a block party or other gatherings where it's not about focusing on people's problems, but celebrating
Yep.
the community. You're still doing a fair amount of that.
Yeah, very well said. We just had Baby Palooza on Saturday, had 700 or 800 people show up to that. We had a large community training event. We had about 600 people there a few weeks back. We do an annual block party in the South End. A couple thousand people come out to that. That all sounds great, but I mean, I think that um, those, to Paul's point, it's not just fun, it's things we all want. Right. And so it's ultimately when we're designing programs, it's would I attend this with my kids? Would our staff show up to this? It's not this us and them thing. It's like we're talking with residents, we're doing things with residents, and then ultimately, what's the way in that somebody wants to get support? What's the way that somebody wants resources? Well, first of all, we're going to ask folks, like, what do we think about this? Through our community advisory process, our family advisory process. But yeah, it needs to be universal in terms of the things that we would also enjoy. And that's not because I want to go and have fun, but it needs to be something that is not so stigmatized that it is just for a certain group of people. And I think that is part of the reason is that we want people to interact in a safe, trusting environment that is fun because they deserve those experiences just like the good parts of town. And
Mhm.
so if they are experiencing that, then they are more inclined to have the things they need in terms of trusting and accessing help, right? So hey, we're all part of this neighborhood. If you're at this event, you're probably going to connect with different resource tables and people, and we can get you supported outside of this. So I think the goal of those fun activities sometimes can you can feel it when you're there, but it sometimes feels like, what's the point of this? And it's like, how many people, because they attended this, are now going to access these other core services? It's a significant number. But I'm also it comes down to this like rising tide, lifts all boats that all of a sudden our community, which when I started hosting things there was not a destination, it was a place you drove through. And now families are coming to this part of town and they are saying, oh, this is where there's great family opportunities. And it changes how I feel and experience where I live, and it impacts the kids and families that are there. So it's all part of that. William Glasser said, fun is one of the big five things you have to have in your life. And so if you want to take it from the academic side, then go read that book. But I'm taking it from the practical, universal thing that all of us want to experience joy and have fun with our families. So
Okay. Thank you, Keith. Jennifer, I'm going to turn it back to you and see if other people have some questions or comments. Otherwise, we follow your lead on this.
Thank you, Paul, and thank you, Keith, for this amazing presentation. I don't see any questions in the chat, but I'm just gonna give 30 seconds here or a minute to see if anybody wants to unmute and chime in case they were nervous about interrupting. So I know it's going to be an awkward silence for a couple seconds here, but maybe if we can just wait so we give anyone who was nervous about chiming in the chance to do so.
Hi, I'm Maria Velasquez, Berks County. I just want to say thank you for sharing. I think it was a very interesting conversation and a lot of learning from you. So thank you so much.
yeah, you bet.
Thank you, Maria. Anyone
Yes.
else?
Hi, I'm sorry, I didn't mean to interrupt you. This is Yvonne. I just wanted to say, keep up the great work because this is something that is truly, truly so much needed all over, all over. And the diverse part of it is really like I've been I've done work like this. I've been working in this job for 31 years. So the challenges and the outcome, we may not save everybody, but just reaching one and that word of mouth, that's where it comes from, building on and just being able to trust and build the community up where we're coming from. And our hearts are in it. This is not a job. This is God's work. And it's rewarding, and you keep up the good work that you guys are doing. Paul and Keith, thank you for this presentation as well, too.
Thank you, Yvonne. This is such an interesting point. Keith and I have talked a lot about this over the years, the whole idea of word of mouth and customer service, and why it's so important to create that kind of an environment where people feel good about accessing support or services and not hesitating to go to government offices or something like that, right, where it's not quite as welcoming or open. But they engage with somebody from Keith's office or your shop or whomever, any of you on this call. I think people feel more respected and more likely to share the full scope of what's challenging them at the time.
Oh, one last statement. I know we have to wrap up. Something that's evolved, I think, in the past 5 to 6 years for me has been humanity towards government. And I think that has improved the tone and nature of our relationship and how we partner with government. And I think that providers that are doing this work, and government who is doing this work needs to think a little bit about how we approach each other. It's easy to think about kids, it's easy to think about parents, but sometimes how we partner and have respect for those that are in the field, not just those that are in the nonprofit, not just those that are in government, but for each other, that we have different roles to play. And we've started to understand deeper around the roles that we're responsible for, the roles that government can provide, and how we use each other without it being a blame game. And that is something that I think could save you some heartache if you are able to find that shared humanity with those that are in the other side of the aisle, right? If you're a government worker thinking about nonprofits a little differently, if you're in the nonprofit space, maybe thinking about government a little differently, that these are good people. They're in a system. How do they work within that system to help you?
Yeah. Yeah. And I think that's key to it, right? Is everybody knowing their role. What can they do best? And yeah. Okay. Well, Jennifer?
All right. Well, thank you both so much again for amazing presentation, and thank you to the Children's Trust Fund for partnering up with us to put this presentation together today, and Paul for bringing Keith to us. And so I just wanted to have you all information about upcoming opportunities. We don't have the schedule out for our webinar series for the coming year yet. This is the last in our series for the 25-26 year. But we will be getting that to you soon. Any of you who are parents as teachers or children's trust fund folks, and you have not gotten information about the specific learning communities for those groups, please email us at Family Support, and we'll make sure that you get that information. And we hope that we do see all of you at our upcoming Strengthening Families conference that will be in Lancaster, PA this year. And there is a link to take a survey, and that helps us to develop these webinars. And I believe Christine is going to put that in the chat. You will also receive an email with that information as well following this webinar. And then I think that concludes our webinar today. And thank you for everyone who attended. And thank you again to Keith and to Paul for being here.